Mr. Taylor, a 45-year-old man, presented to the ER with acute onset of left-sided chest pain and shortness of breath. He reported no recent trauma but has a history of chronic alcohol abuse. His vital signs were normal aside from mild tachypnea. Chest X-ray showed an apparent left diaphragmatic hernia with loops of bole in the left hemithorax. CT of the chest confirmed a posterior left diaphragmatic defect with herniation of the stomach and splenic flexure of the colon into the thorax. There was no evidence of strangulation. The remaining bole and solid organs appeared normal. Mr. Taylor was admitted to the surgery service and taken for urgent laparoscopic repair of his traumatic diaphragmatic hernia. His abdominal contents were reduced and the defect was repaired primarily using interrupted sutures. A chest tube was placed due to concern for possible pneumothorax. His hospital stay was uncomplicated and the chest tube was removed on post-op day 2 once no air leak remained. He was discharged home on post-op day 4 tolerating a regular diet without difficulty. Outpatient follow-up showed excellent recovery. Commentary questions. What are common causes of diaphragmatic hernias? Blunt or penetrating trauma, prior surgery, congenital weakness or defect in the diaphragm. Increased intra-abdominal pressure. How are left-sided vs right-sided diaphragmatic hernias different? Left more common due to protective effect of the liver on the right. Right-sided often remain undiagnosed longer. What symptoms may be present with an acute diaphragmatic hernia? Chest/abdominal pain, dyspnea, nausea, obstructed bowel habits. Potential life-threatening cardiorespiratory compromise. Why is early surgical intervention often indicated? Risk of incarceration, strangulation, and visceral necrosis if hernia contents not reduced. Also risk of respiratory compromise. What postoperative care considerations are important after repair? Pain control, pulmonary toileting, chest tube management if placed, monitoring for pneumothorax, recurrence prevention with activity restrictions.